You're welcome.
Thank you.
All right, we will get started. So I would like to start by introducing myself. My name is Sean Neighbors. I'm a former graduate of Western Michigan University, the Counseling Psychology program, 2014. I was sitting right where you guys were sitting about 2 years ago. So I'm the founder of the Anxiety Treatment Center in West Michigan, and we primarily specialize in using CBT and exposure therapy. And right now I'm working on my doctorate. I'm a first-year student in counseling, education, and supervision. So before I get started, since we are talking about theory today in CBT, I want to ask you guys, has anyone kind of gravitated towards a theory yet, or is anyone kind of in the eclectic range, or?
Eclectic, we were just talking about it before class.
Yeah, that was interesting. You guys were kind of mentioning
that. For the semester, I have picked Adlerian.
Adlerian? Okay, and what draws you towards Adlerian?
I like the kind of collaborative nature of it.
Okay.
The idea that you have to look at the whole self, the past and our family of origin influencing where we are now, but being goal-driven and forward-driven.
Okay. So a combination of goals and then looking at the person as a whole.
Mm-hmm.
Okay. Good. You had mentioned that you were kind of.
Yeah, I'm existentialist humanistic, but I've been learning about ACT from Stephen Hayes. So I gravitate towards this a little bit. It's a little bit more philosophical, kind of. It's almost like Gestalt, I would say.
Okay.
About really experiencing those emotions and thoughts and those kind of things. So I really appreciate that. But I'd say ACT and then probably humanistic existentialist is like the foundation.
Okay. So what's happening right now in the room is what's important for you.
Yeah.
Okay. And being there with that person in that moment.
Yeah.
Okay. How about?
Yeah, for the semester I picked person-centered, so I can get that foundation, that strong foundation. In the past I've always gravitated towards cognitive behavioral therapy.
Mm-hmm.
So I'm just kind of seeing how the semester goes. But.
Yeah. So are you using a little bit of both right now with your
No,
client?
I'm just doing person-centered.
Okay. Mm-hmm. Okay. Do you plan on incorporating some cognitive aspects, or?
I really like a lot of like the homework aspect, and then like the different thought exercises and things like that. So.
Okay.
Yeah.
And with person-centered, what do you like about it the most?
That it just focuses primarily on the client and whatever the client.
Okay. So one week they can have problem A and you focus on that, and the next week they have problem B, and then you're right there with them.
Yeah, whatever they want.
Okay. How about you?
I'm also person-centered, and kind of the same reasons, really being present with the client, having like a deep understanding and that empathy and the feeling for them.
Yeah. So that's huge on rapport building.
Mm-hmm.
So one of the outcomes for therapy is rapport, and how strongly you can get that. And person-centered is a great way to establish that within the first few sessions. So I often, with my clients, see rapport being established in the first session when you take a very person-centered approach. They're excited to come back. So, and you?
I'm also person-centered, and I like the same things. I like that it's very focused on the client and that it focuses on the relationship between you and the client, and that the client is really very much in the lead of what what's going on, their goal setting and what's talked about. But in the future, I just want to do some more exploring, because I do feel like a little trapped in it, that you really are just focusing on the basic empathy and it doesn't really leave a whole lot of room for other techniques. So just exploring what I can do with it.
Okay, so kind of trying to add more onto a foundation of person-centered?
Yeah.
Okay. Has anyone ever had the feeling of maybe 4 or 5 sessions out, what do I do with my client then? Maybe we've talked about the same issues before, we're kind of in a pattern here. Anyone ever had that thought or projected out that far?
We haven't had the clients for that long.
Okay. You may get there, but that was my experience. I was heavily person-centered, and I loved it, but I don't know, I like structure in what I do. I like things to be very organized, And so I gravitated towards CBT because it gave me some sort of structure. One of my supervisors called it my blankie. So CBT was like my blankie because I felt vulnerable sometimes in a therapy session. And it went from being my blanket to actually being something that I realized that this is what I do naturally in my everyday life. I'm always monitoring my thoughts and how rational they are. Well, initially I was drawn towards rational emotive behavioral therapy, and then I kind of branched into CBT. So that's just a little background on how I chose CBT. And as a kid, I was very, very anxious, socially anxious. And come to find out, CBT and exposure therapy combined are two of the most empirical treatment forms for anxiety. So that was a great fit. So things just kind of fell in place there. So we'll go ahead and get started with the lecture. So the objectives today are to develop an understanding of the cognitive behavioral model. So CBT is very huge on models. The next one is to analyze the concept of collaborative case conceptualization. So you all do a fair amount of case conceptualization in here as therapists together, and in CBT, you do a lot of that with the client. So you and the client will actually collaborate what their issue is together, and it is kind of person-centered, driven, because if the client says, I don't feel this is what's wrong with me, then you kind of reconceptualize what's going on with them. So unless you're a specialist and they're coming to you for answers, I specialize in anxiety, so clients, they come to me and they don't want to tell me what they have. They want me to tell them what's going on with them. So, but I still normally try and do some collaborative case conceptualization. And then evaluate cognitive behavioral therapy in action. So what I'm going to do after we go over the model and we go over conceptualizing how to do that, I'm going to walk you through how I treat someone. And I want you guys to kind of evaluate what fits with you, what you like, what you don't like, what you're confused about. Just kind of come up with an overall evaluation of it, and we'll kind of talk about that after the presentation. So cognitive behavioral therapy is a system of psychotherapy that attempts to reduce excessive emotional reactions and self-defeating behavior by modifying our faulty, erroneous thinking and maladaptive beliefs that underlie these reactions. So it's focused on how can we get you to think healthier or more rationally, and how can we limit your mood swings, because it's, we try and strive to be in a neutral state. How can we limit those? By focusing on the content of your thoughts. That's pretty much what that summarizes. So the approach is collaborative, it's active, based on open-ended questioning. So those are techniques such as Socratic questioning, guided discovery. If someone gives you something and there's probably 5 more minutes worth of what they give you, even in the most briefest of statements. So by using open-ended questions, you can get a little deeper with that person and their thoughts. And it's highly structured and focused. So the structured is praised and it's criticized. So some people say it's too structured, I need more leeway with my clients. CBT says I should do this today, but my client's coming in with this. What do I do? So that's a criticism of it. And then also the structure is praised because it really guides therapy. So you kind of know what you're going to do with your client from week to week. The only thing I know that's more structured than CBT is dialectical behavioral therapy. So there may be some other things that I'm not aware of, but that would be the one thing I know that's more structured than that. So CBT is not just cognitive. As soon as a client comes in my office, I'm not, what are you thinking? What's in your mind? This is all we're focusing on. So it works off of the psychosocial model, which takes into account environment, physiology, biology, behavior, emotions, and then finally thoughts. So thoughts are on the bottom for a specific reason because this is where we want to end. We want to try to help the person in these areas first before we automatically assume that they have dysfunctional thinking. So when someone comes in my office, I'll assess their environment. What's their living conditions like? Maybe they're a very rational and balanced thinker, but they're just in a very toxic environment. So we'll move to a bit more of a solution-focused approach and help them to get out of that situation. What can happen is that we can waste a lot of time on cognitions if it's their environment. And the same goes for physiology and biology. Maybe they may be on some medications that are causing some maladaptive behavior. They may have an actual illness that's the culprit, and we may need to address those things first. Now, I'm not a doctor, I can't address those, but I have a lot of resources. I know a lot of people in the medical industry, a lot of people in the psychiatry industry, so that's kind of that collaborative approach that we take with other helping professionals. So, I have a client, it seems like this is going on, could you get them in for an appointment and see what's going on? Maybe they have some gastrointestinal issues that are causing them some elevated anxiety. So, behavior, so that more so speaks to behavioral cycles. So someone may be in a behavioral cycle that they're completely unaware of. It's just below the radar. And that is either conditioned classically, so classical conditioning or operant conditioning. And we pretty much just break that cycle of the behavior. So they're doing that behavior so much that it's beyond, their thoughts aren't causing that. It's the conditioning that's causing it. And emotions. So normally when we get to emotions, that's my cue to go to thoughts. So if it's not environment, biology, physiology, or behavior, and they're having a lot of emotional disturbances, then we kind of move into going into their cognitions. So, and I forgot, this is a very active and open lecture, so if at any time you have a question, that's the time to ask it. So don't feel any way interrupting me. So I like questions to be answered when they're thought of. So Christine Podesky has a biopsychosocial model. She is I don't know if she's world-renowned, but she's definitely popular in the United States. She tours the United States giving lectures on cognitive behavioral therapy. And this is her model that she conceptualizes any issues outside of cognitions. And this is also the model that she uses to conceptualize issues with the clients. So this is the case conceptualization model that a therapist would do with a client for CBT. So it covers the same thing on the previous slide, so thoughts, behavior, biology, mood, and feelings. So we're just going to jump into a scenario real quick. So you're walking down the street and someone you know walks by you without acknowledging you. So this situation is used frequently because it's one of the easiest situations to draw up some distorted thinking, some unbalanced thoughts about that situation. So 3 interpretations and 3 emotions. So we're going to look at a thought and we're going to guess what the emotion would be for that thought. So the first thought, she's probably still hungover from that party last night. Now, that may be a little biased or stereotypical or prejudiced response, but what emotion do you think would be elicited for someone having this type of thought about that incident? Go ahead.
Disapproval.
Mm-hmm. So they may be disapproved.
Anger, maybe even some relief.
Mm-hmm.
That she's probably just hungover, so
Yeah.
it's not me.
Yeah, and you had something else?
Also, it could be comical too.
Yeah.
Yeah.
Yeah. So disapproval, relief, and comical. Those are emotions that aren't so much on the extreme side. They're kind of neutral emotions. They're not going to cause too much of, a behavioral response from your emotion. Let's go to the next one. Nobody wants to talk to me. No one likes me. What type of emotions would this automatic thought elicit? Go ahead.
Sadness.
Yeah. So they start to feel very sad about themselves as a person and how they fit in with society. And that could elicit some future anxiety. Next time they're around someone who they know, they may be questioning, people seem to know me, but they don't always talk to me. So now we have the pattern of a maladaptive belief, an uncomfortable emotion, and now maladaptive behavior getting ready to start, which is possibly avoiding social situations. She's got a nerve being so snooty. What emotion would that elicit?
Anger.
Yeah, anger. So now instead of being sad about your place in the world, now you're angry about your place in the world. So instead of being sad that people don't care about me, now you're angry. The world doesn't care about me. People don't care about me. You know, people can be mean to me in the drop of a hat. Good job. Sorry, I notice I'm standing more to this side. I'm going to check my alignment. Sorry. So the conscious and subconscious mind. So every time I think of an iceberg, I think of the movie Titanic. I can't help it. It's just, they're paired forever. So we have access to 10% of our cognitive functioning, and the 90% of the rest of our cognitive functioning is below our level of consciousness. So people come into counseling because of these two, right? They're getting results they don't want, and they're behaving in a way they don't want. And sometimes they may be aware. Some people have some insight into their emotions, but most don't. But primarily they're getting results they don't like, and they have behaviors that they're very, they're just disapproving of themselves. They don't like it. It's not a part of them. Next are the emotions. So like I mentioned before, some people have some insight into these. So if you look down into the water, you can see, maybe 10, 15 feet into the water. But most people don't have access to this area here, which is the thinking. And the thinking is broken up into 3 different levels, and we'll get to that next. But that really deep core belief types of thoughts that are just beyond people's awareness, a lot of people don't have access to that unless you do techniques to help you bring that up to the surface. So does anybody do any meditation, any mindfulness, any type of, what do you do?
Just mindfulness exercises.
Okay.
Just kind of being in the moment and trying to just be at peace.
Okay.
Instead of having all those random thoughts come through your mind.
Okay. And when you're doing that, when you're in the moment and you're at peace, you're attempting to be at peace, what do you notice when you're doing that?
It depends on the day I'm having. Sometimes, anything from work to school to what my daughter's doing comes through my mind, and
Okay.
I'm bothered more by the thoughts in my mind than by any noises on the outside disrupting me.
Okay. So is it the flooding of thoughts that kind of
Right.
bothers you?
Yeah, it takes some effort and some practice to try to kind of block those out and
Okay.
let them go for a little bit.
Okay. And when you do that type of mindfulness activity, what's your goal when you do that? What are you hoping to accomplish?
Just to relax enough so that when I come out of that and I go back about my day, those things aren't flooding my mind. I can take them one at a time and just deal with what I need to do in the moment instead of thinking 10 steps ahead about what I have to do, 3 hours from now or 2 days from now or whatever.
So you're trying to calm the flooding of those thoughts and be a little bit more focused and balanced.
Right.
Okay. Anyone else do any type of?
Oh, I have a question.
Hey, go ahead.
So for the people that do have insight into their emotions and thinking, is it possible that someone could have insight into just like a certain type of thinking? Like there's you get results and behaviors in some aspects that I don't understand why I do this, or I don't understand why this is happening. But then on the flip side, there are some things that you can analyze enough to understand, well, this is why I feel this way, and it's because I think this way. So is it like 100%, or is it? It
varies. So nothing's absolute. So it does vary. And I think what that's based on is how much we emotionally process situations. So people may emotionally process one thing better than they process another thing.
Okay.
And when you emotionally process that, you're getting the feeling from that. You're getting your thoughts from it. You're understanding yourself better from it. So I liken it to grieving. So if people don't go to a funeral, they have a hard time coping with that death. They don't get to see the body. They don't get to see the casket. They don't get that final closure. And they kind of really don't know what they think about that situation either. They're still distraught a little bit by that at different levels. But when you get that final closure and you get to emotionally process that, then you kind of know how you feel and think about it. So I would say emotional processing may have to do with that. Maybe they avoid processing some things and they actively process other things. Is there any tissue in here or Kleenex?
I can get you some.
Okay. Thank you. So next we'll talk about the 3 levels of thought. So you have your automatic thoughts, which are conscious or unconscious, automatic, spontaneous thoughts beyond your control. So as I was reading that, I was thinking about my nose is running, I want to eat pizza later on tonight. So those thoughts just come. You can't stop them. That's just how, we're made. The next one is underlying assumptions or intermediate beliefs. So these are mostly unconscious rules we have about ourselves, others, and the world, primarily in the form of if-then statements. So this is how we categorize the world. This is our blueprint of how we make sense of the world. So if I go to graduate school, then I will graduate. That's a belief we have. That's why we come. We don't come here just to have fun and hang out. We're here for a mission. If it's dark outside, then I won't go down the alley. If I smell pizza, then I'm probably going to want some.
We gotta stop talking about pizza. You're making me hungry.
Yeah.
We see where my mind's at.
Yeah.
So it's how we categorize the world. It's how we make sense of the world. Now, those underlying assumptions can also be maladaptive. So if someone gives me a compliment, then it's for an ulterior or alternative motive. Maybe they really didn't mean the compliment. So that's the rule you have about compliments. So anytime you get a compliment, you have an underlying assumption that they're really complimenting you for an ulterior motive. The core beliefs, almost always unconscious, absolute beliefs we have about ourselves, others, and the world. So what these do, these take this and just make it definitive. So maybe they're complimenting me for the wrong reason. The core belief would say, I'm not worth complimenting at all. For the dark outside scenario, nighttime is dangerous. So they're absolutes. So this is the model for CBT. So based on the situation, we have a thought at various levels, mostly the automatic thought level. And then we either have simultaneously a physical reaction or a mood or emotional reaction. And it's not so much the thought that dictates the behavior, although that's possible. It's more so how you feel mood-wise and physiologically or physically that dictates the behavior. So if you're angry and you start doing angry behaviors because you feel angry, it's not because your thoughts are saying, hey, smash that lamp, punch that wall. You just feel very angry. And that emotion dictates you to release that. If you're very sad, you feel very sad. So your thoughts aren't telling you, hey, you should cry now. You just feel that, and you start doing it. So emotions really dictate our behaviors. For anxious people, they may panic because they feel like they're going to die. Their heart is just pounding against their chest. And that feeling is just, they can't shake it. Go ahead, yeah.
So for those core beliefs, if you change your way of thinking, would it be, safe to say you could change your core beliefs?
Yeah.
Okay.
Yeah, so that's the goal. The goal is through identifying automatic thoughts, we can identify a core belief. And then our goal is to modify that core belief or the schema. Thank you. I have a bit of a runny nose. Thank you. So any questions on the model? So this is another version of the model. And this version of the model just highlights the cycle. So you have an event, you have the person, that person interprets thought from the event, they develop an emotion, that emotion guides the behavior, or the thought may guide the behavior, but then their behavior reinforces their thought about that event. So for example, if you have social anxiety, you have a thought of no one likes me, therefore you feel anxious, Therefore, because you're anxious, you avoid social situations. And because you're avoiding social situations, you're avoiding friendship. And therefore, you develop a thought, hey, I don't have any friends. It must be because I'm socially anxious. However, your avoidance behavior is actually what's causing that. So the behavior can actually create a new maladaptive belief.
So it's a self-fulfilling prophecy.
Yeah. Yeah. So here are the levels of thought in action. So there's a social gathering. The automatic thought is, no one will want to talk to me. The intermediate or underlying belief is, if someone is critical of me, it means I'm not a likable person. And the core belief is, I am unlovable. So this core belief is feeding your rule. This rule is feeding those spontaneous thoughts that pop into your mind. And the reaction, so the physiological reaction to that is tension in your shoulders. The behavioral consequence is that you're quiet, you avoid eye